Any questions for the panel? Yes, front here.
Hi, my name is Sue Elvin and I'm nurse consultant. Fortunately, I work in Claire's organisation, CNWL, and I'm the only nurse consultant for district nursing in the whole of England. There's only one other in Scotland. And the question for the panel is that compassion, obviously, I was interested in the job that I do now because in the job description what stood out for me was a phrase that said to act at all times with extreme kindness, and I thought, yeah, that's the job for me. But we find ourselves in a situation with district nursing where when you're seeing 12, 13, 14, 19 patients a day, it's very, very difficult for those staff, and they're fantastic staff, to give the care. And frequently I'm working alongside these nurses every day and they're very fearful for their registration. And I attend lots and lots of safeguarding meetings. And as a nurse, when a patient gets a pressure sore, pressure ulcer, you feel like a personal failure. It's something that's against, the core of your practice. So I just wondered what the panel thought we could do about the big elephant in the room, about the unacknowledged funding that's missing from care in the community. And I think we have to be very careful with the compassion campaign, that nurses aren't left feeling that in some way it's their fault that they're not compassionate. Because when you regularly stay late at work, 9, 10 o'clock, you do also have to be compassionate to yourself. You have to be compassionate to your family. It's a big dilemma for nurses, and we lose so many good nurses because they just can't take the pressure. So I just wondered what the panel felt was best to kind of be able to do about that.
I'm going to ask Caroline to respond to that, but I'm also going to, I'm wondering if Martin, in terms of the Better Care Fund, might want to say a word or two around it as well. So Caroline.
Yeah, no, I fully understand where you're coming from, and in London, I know, I think historically, community services haven't had the exposure for a very, very long time, and this is an issue that has grown and grown and grown and become more sort of visible and more critical as the system needs community services more and more. So we've had conversations in London, with lots of nurse directors and colleagues, and had a trip out to the Netherlands who actually were looking at services and how they model, which is self-governing teams, no guidelines. It goes back to the roots of why we do things. So in a roundabout way, I fully agree we've got to do something quite strategic, but also quite grounded in practice, because actually you've got to be involved in the design of future services. We've got to create the space for you to do that. And actually I don't believe we have the right change models to support community service change in the way we have in other services, and that's partly why we failed. So it's a very roundabout answer in saying, in my eye, and why I said in my slide, community services are absolutely at the top of the agenda if we're going to change things, and we need to get CCGs engaged, and also we need to stop it being a nursing issue and actually have other people like local authorities, the CCG chief officers and chairs who often are GPs in that conversation if we're going to get this taken seriously. It's not just a nursing issue.
Martin, did you want to say anything about how your aspirations around Better Care Fund, rebalancing the spend?
Caroline's given me an excellent lead-in. So just by way of context, so in my local authority, in the last 4 years, we have had to reduce our controllable budget by 30%. We've lost 20% of our workforce and 30% of our pay bill. But actually, most of our services are still being delivered well. I don't think that's because we were funded generously beforehand. I think it's because we've reformed everything and looked at every part of our activity and operation and changed the way we've done it. Now, my magic wand answer would be to conjure up more money, but I know I can't do that. So with apologies to Ashley, part of my job as a Chief Executive of a local authority is to try to look at how I can help make public services operate better in my place. I can still ask for the money, and I can still make the campaign for the money, but I've got to recognise that I'm probably given that conundrum to solve, and I'm working to solve it. I still think there is a lot to be done in the spaces and boundaries between individual public services that operate in particular localities. I think whenever you look at the boundaries between functions, professions, organisations, structures, governance models, you find something that you can do better. So Mike made a useful reference to the Better Care Fund. So the advent of the Better Care Fund, which is forcing CCGs and local authorities to pool their funding and sit around the table and think about better ways of using it, I think is an excellent development, and it's a catalyst for some of the changes that we need. And I've seen this working already, but hopefully will enable us collectively to find better models to work across local authorities, CCGs, providers, the whole constituents of the system of health and social care and beyond. Now, do I think that's the answer to your question? Probably not. But I do think it will get us some way to dealing with that conundrum, and we'll be in a better place for pursuing it. And I think, I suspect that's why Caroline asked me to come here today, and I suspect that's why I said yes, because I think we've got a lot to do together that can, improve some of the difficulties that you've described.
I'm going to take a couple more, because I know that both Claire and Liz are keen to say something on that. But I'm going to take another couple of questions, and then I'll bring Claire and Liz in on both this question, but also any of the other questions that come in. So can I see if anybody else would like to? Yep, thank you.
Thank you. My name's Shelley Dolan. I'm Director of Nursing at the Royal Marsden. And I just wanted to applaud the nurse consultant who just spoke. I think it's, in my 28 years of nursing, I've never worked in the community, and I have been hugely proud and privileged since 2011 to work with community nurses. So I just want to give a bit of a ray of hope. So I have worked amongst nurses who have worked far too long days, who are really too tired, and who still manage to do it every day. And I recognise exactly what the nurse consultant said. But my recent experience has been working with a fantastic CCG and local authority, and working together to look at where there is duplication in our communities, and where actually even with the 30% taken out, we can probably afford, by looking at different roles and by looking at less duplication, to actually increase our nursing workforce. And so Sutton and Merton CCG have actually recognised that and have actually put some more money in. So sometimes it's about redesign, sometimes it's about doing things differently, but sometimes it is about showing that actually you do need more staff, and actually the bottom line does need to increase. So I think I'm hugely privileged to see care in the community. Never seen it before in my huge career, but actually it's fantastic what people are doing in people's homes, and we need to understand the pressures and support and resource it. So I think there is hope for doing that.
Thank you. I'm going to ask Claire to come in, because I made the mistake right at the beginning to say that she was Chief Executive of a mental health trust, when in actual fact she's Chief Executive of an integrated care organisation with mental health and community components.
Yeah.
So Claire.
I want to make a few points really, really quickly. The first one is that I do think that our community nurses do the most amazing job, and we've just recently conducted a massive, as Sue will know, patient survey across the 3 big boroughs where we provide community, adult community nursing support. We've had the patient survey results in, we were looking at them last board, and I've got to commend you and your colleagues, because the patient satisfaction scores in those surveys were tremendous. I mean, unbelievably brilliant, and this was an independently conducted survey by Quality Health, so congratulations. Secondly, yeah, we do need more resource coming into the community. We can be more efficient. I'll say something about that in a minute, but we're not filling, and that's not just CNWL, in London, all of the nursing vacancies we've got, which, as you will know, in 1 or 2 of our areas is a big issue. So I think that there is a systemic issue that would make such a huge difference, which is about, for me, pride in the profession, promoting it as a great thing to be doing, growing wonderful new nurses up through the system, because we've got vacancies we need to fill. So before we get even more resource, and one of our CCGs has likewise invested, but can we fill all of those posts currently? with the calibre of nurse we're looking for. We won't lower the bar. We can't. So I'd like to offer these three a job. Work for us. We're terrific. There are some other very good trusts in the room, but we're better. We're currently doing another piece of work, though. As you will know, we're just about to roll it out. We've started in Hillingdon with our adult nurses, looking at can we cut the bureaucracy by 30%. And they've been really engaged in that in Hillingdon. And we're about to roll it out to Milton Keynes and Camden, because actually we can do a lot to cut bureaucracy. We really can streamline the paperwork and the processes, and we must stamp out. I think it talks to some of what you were saying. And finally, I suppose I just want to say no nurse should battle on with a caseload she thinks is unsafe, he or she thinks is unsafe or untenable. And so and I know that we're very cited on some of the pressures in our organisation, but I cannot emphasise enough, you have to really be prepared to say we'll do our best today, because no nurse turns their back on a patient, but actually you have to be vocal and speak up as well. So, but I do want to end very controversially by saying, and this will get me the sack, I think that what's happened in contract negotiations this year is a disgrace around something called the tariff deflator. People will have seen me tweeting about it, and I've decided to call it the tariff discriminator. But it's the tariff deflator, sorry to be controversial, but the tariff deflator is the sum of money, the percentage that gets taken off of your contract every year at the minute before you start contract negotiations. And it was 1.5% off of all of our contracts because we can be more efficient. This year, it's 1.5% for acute trusts and 1.8% for other trusts, because acute trusts have to implement Francis and staffing. It's just wrong. So resource is also part of it. I'm sorry to be controversial, but I'm quite angry about that.
Okay, I'm going to bring Liz in. And Liz, can you be brief?
Yes, I'll be very brief. Yes, I think there's an arithmetical issue to be addressed. We know that the numbers of people needing the service is increasing. We know that the age profile is changing, so the need for greater care, more complex care is increasing. And anybody who listened intently to the Chancellor's budget yesterday will know that the resources are about to be dropped even further than they have been across the spectrum. And I think the challenge over the next couple of years is we need to, as Sue says, the elephant in the room, we need to actually say, with less resource than you've got at the moment, because clearly there's going to be, what is going to be the priority? And compassion can't suffer. So it really does need great minds brought together. And part of that is reducing the waste, because there still is some waste in the service. Thank you.
Okay. I'm going to give Caroline the last word before making final announcements, as well, I wouldn't be here if she hadn't invited me. So it's so Caroline.
Just to say, what we will do is a London conference on community nursing fairly soon. We'll have an absolute focus on what we need to do with broader stakeholders around the table to help us do that. So that will be the commitment from this morning. Yeah, there you go. Right. There you go.
About budgets, being kind is free. It doesn't cost you anything. It doesn't cost you anything to be kind. So
I think that's really useful to remember that, because the whole of today's event is about hearing from your colleagues, working together.